Hey, everybody. We are back for episode 2, and we actually have another guest that we've gotten to meet. His name is Dr. Ron. I'm not going to butcher your last name because people do that to me all the time. Um, and we're just going to continue this kind of journey with different people, and we want you guys to all meet Ron. He is very in the weeds. He's also been on a lot of podcasts, a lot of big ones. So we're glad he obviously wanted to come on ours as well. Um, so yeah, Ron, let's just get a little history just on your. I mean, you're obviously a doctor, so you've been in school a long time. So let's just get to meet you a little bit here.
Yeah, I have been in school. Not for a long time though, but I was in school for a long time. Yeah, it's over with, thank God. But thank you, Chris. Yeah, so I am an emergency room doctor, and um, I opened up an urgent care center in. I live in Maryland, and I opened up an urgent care center in 2016 because I'd always wanted to be kind of my own boss, and I had an entrepreneurial spirit, and I just really wanted to do something on my own. So I opened up an urgent care, and it was, I never actually worked there clinically. I was just the medical director, and I had nurse practitioners and PAs who would kind of see the patients. And then in late 2019, when China was being forcibly shut down because of the coronavirus, the COVID-19 that was popping up, even though the CDC and the FDA and every governmental agency said, "Oh, you don't have to worry, it's not coming to the United States," I kind of realized that it was obviously going to come to the United States. There was no way it wasn't going to come to the United States. I mean, when they're boarding up entire cities and putting tanks in the streets and pointing them into the cities to keep people in the cities, clearly this is something to worry about, and it's clearly gotten out already. So anyway, I realized what was coming, and I started to prepare. So I started to purchase as much personal protective equipment as I could, and I started to purchase as many testing supplies as I could. And because of that, and because we were very sort of active and proactive, we became the de facto testing center for my county, and then pretty much for the state of Maryland. And we had about 6 employees before COVID, and then at the height of the pandemic, we were up to about 300. And we went from one site to about 8 sites within probably 7 months, 8 months, something like that. And when the monoclonal antibodies became available, I was a very early adopter and a big proponent. I was on national and international news probably at least once or not twice a week, talking about how wonderful these things were and how they really represented the cure for COVID because they were so amazing. These drugs were just so powerful and so amazing, and they really could just cure people. And then I started to question the vaccine for all narrative because it didn't really make any sense to me. I was on TV and I was saying, why are we pushing this so hard when we have a cure? Yes, the vaccine has a place, but it doesn't mean that everybody needs to be vaccinated. We have a certain population that this should go to, but yet the mantra was vaccinate, 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 and that made no sense to me. And I started to question that. And then the Biden administration uh, federalized the distribution of the monoclonal antibodies, which led to shortages very, very quickly. Before that, if you wanted to order the drugs, you would just contact your distributor. The government gave you a code, and you would use your code, and you would contact your distributor, and you could get the monoclonals, and it was no problem. And actually, because we were so successful at it, we became the largest supplier of monoclonal antibodies in the state of Maryland. And actually, the federal government reached out to me, the Department of Health and Human Services, and they said, "Hey, you're really good at this monoclonal thing. Can you help us? We want to set up a site at FedEx Field where the Washington Redskins play football. And can you do that for us?" And I said, "Absolutely." So we formed a partnership with my company, the Department of Health and Human Services, and the Maryland Department of Health. All three of us went into business together, and they paid for everything. And we set up the site. I staffed it. I ran it. And initially, they were very hesitant to allow us to have testing there. And I said, "Well, we should be testing." And they were like, "No, no, no. We just want to treat. We just want to treat." And I convinced them that testing was the right thing to do because we could take somebody from the testing chair. You get your nose swabbed. You go back to your car and wait for the results. 15 minutes later, we'd have the results. And if you were symptomatic and you tested positive, we could take you right from your test, put you right in the infusion chair, and cure you right then and there of your COVID. And that actually became the model for the entire country. That idea, we called it test to treat, and that became the model for the rest of the country. So anyway, there was no problem getting these monoclonals until the government decided to federalize it, and then they controlled distribution. And then they did something that I've never seen before in my entire career. I don't think any doctors have either. They decided to start using equity initiatives to determine how they were going to distribute the medicine. So it no longer became a question of need, it was a question of equity. So, for example, if you remember, Florida is a great example. There was a large outbreak of COVID in Florida, but the Biden administration refused to send it to Florida. And Ron DeSantis, the governor at the time, had to go out and purchase it using taxpayer dollars. He went right to the manufacturers and said, hey, Eli Lilly, can I purchase this from you? And they said yes, and they sold it directly to the state of Florida, even though the federal government had massive amounts of this stuff, but they refused to provide it where it was needed. It was purely based on equity, which makes zero sense. That's not how you do anything in medicine. It's all based on need. And this represented really the government getting between the doctors and the patients. And then they made a catastrophic and very stupid decision in late December of 2021. They issued an edict that said once the prevalence of Omicron reached 70%, and there was a surge of Omicron at the time. And they said once the prevalence reached 70%, the monoclonals that we had available to us were no longer efficacious against that particular strain. Therefore, they were going to shut the whole program down. And that happened in late December. They issued an edict that said we're shutting the program down. So we literally had refrigerators stacked with this stuff. We were infusing probably anywhere between 300 and 1,000 people a week at 3 sites that we had. And by the way, these sites were, we rented volunteer ambulance, a volunteer fire department. We rented their halls, their catering halls. So we turned them into monoclonal infusion centers, which had never been done before. It was very, kind of fly by the seat of our pants, but we were doing things with science in mind, and we were doing it with standard procedures. We had to write all these rules as we went, which was pretty remarkable and actually it was a great learning experience. And we provided a great service, and we were saving thousands of people's lives. And then the government just came in and said, we're shutting this whole thing down for no reason. So I went on Fox News, and I went on Newsmax, and I went on a bunch of other right-leaning sort of entities. And I said, they're going to kill people. They're misreading the data. They don't know what they're doing. I said a lot of things that in hindsight, I probably shouldn't have said, but I was really mad, and they were putting people's lives at risk, and they were taking away people's informed consent. Because as a physician, if I believe something's going to work, and I tell you, the patient, I make you aware of what even if I believe that there's a 70% prevalence, which there wasn't, but even if that was true, and I said, look, there's a 7 and 10% chance that this thing isn't going to work. Let you make that decision. You're the patient. It's your body. Let you make that decision. Why is the government shutting it down? So anyway, I went on it, and I was really pissed. I was very angry. I let them have it. I said a lot of things, and I would say them again because in retrospect, again, I probably shouldn't have because it got me in trouble. But I would probably say them again because I believed what I was saying, and I still do, and what they were doing was wrong. Anyway, 2 weeks later, the government comes out and they admitted that they were wrong, that their data was wrong. And believe it or not, they said that it wasn't a 70% prevalence, it was a 20% prevalence. So they got that wrong by a factor of 50%. Now, only the federal government could make a mistake like that and then face no consequences whatsoever.
Yeah,
I mean, literally 50%. What kind of a moron makes a decision like that? Like, I mean, and they were so sure they were right. They were willing to gamble with people's lives. And that's what happened. And I said to Fox News, I said, I don't know how many people are dead, dying, or in the hospital because of their, insane stupidity, incompetence. And again, retrospectively, probably shouldn't have used those words, but yeah. So,
well, I mean,
anyway,
I get it, and I mean, like,
yeah.
You have a duty for your kind of clients and our customers, and to kind of give them the best.
Well, right. And we're not talking about selling a pizza. We're talking about saving people's lives. And a certain percentage of those people, I guarantee you, not just at my clinics, but throughout the country, went on to be hospitalized and or died because of that.
Well,
now,
yeah,
it was only
my parents have 2 friends. My mom's actually retired ER nurse, and then she went in to just do surgeries because she she didn't want to talk to people. And my dad's actually a retired cardiac surgeon. So I kind of grew up in this medical world, even though I probably had the worst medical treatment because that's usually how it works.
Right.
But I mean, we know two people, obviously they were older, but I mean, they both died on a ventilator in the hospital.
Yeah.
And it's just staggering to hear the horror stories and then just the misinformation. And then there's people like you trying to get stuff correct. Because in California here, you know how you said the test to treat. I'm like, I didn't see any of that going on anywhere around us in California.
Chris, that's a great point. So I'll tell you. So we became so successful at this, at the monoclonals, not because I'm some genius or because I'm some wonderful business guy. I mean, I think I did a pretty good job. But the reason was the way the system was designed. I can't speak to other states, but in Maryland, if I was just a regular doctor and saw someone in the emergency room, for example, and I said, you know what, I really think you'd benefit from monoclonal antibodies, I had to go to a separate website, enter all this information. It was like a 3 or 4 page PDF I had to fill out, which would probably take me anywhere between 30 minutes and an hour, of which I don't get compensated for, by the way. And while I'm doing that, patients are stacking up behind me to be seen. So like, I don't have time to do this. And then I had to print it and then fax it to some number, hoping that on the other end of that line was a person who would actually pick up the phone and call the patient. So nobody did that. So these wonderful drugs that represented really the cure for COVID were sitting idle, not being utilized. So I said, all right, well, how do we fix that? I said, all right, I'm going to create a call center. So we set up a call center where I trained staff to answer the phones, and I set up a sheet of like yes, no questions. They would ask the questions to the patients and identify those people that qualified for the infusions. And I just went around to all the ERs, I went around to all the primary care offices, and I handed out our card. And I said, look, anybody you think qualifies or that you want to get a monoclonal, don't bother, just hand this card to the patient, tell them to call us, we'll take care of everything. And all of a sudden, we the first week, we had 50 people, then we had 100 people, then we had 300 people, then we had 500 people. Everybody was calling because they wanted to get the treatment because it was so good and it worked. And you know, we were bigger than Johns Hopkins. We were bigger than University of Maryland. We were, infusing way more people than they were. So anyway, after all this, they shut the program down. They allowed us to start infusing again. And by the way, they never once apologized for this ridiculously egregious mistake that cost people their lives and put people in the hospital needlessly and cost the system probably hundreds of millions of dollars because of all those people that had to be hospitalized and had to get further care that could have all been averted with a very simple infusion that takes 1 hour. And by the way, I mean, this stuff really did do that. We had people who were on death's door, not exaggerating, on death's door. We would infuse them, and 24 hours later, they were 80 to 90% better. I mean, it's remarkable. So anyway, we go back to doing what we're doing. And then 4 months later, completely out of the blue, with no warning, no email, no phone call, no request for charts, no nothing, I find out that I'm indicted on federal healthcare fraud charges. They hadn't really done any investigation. My name was completely wrong on all the paperwork that they filed with the courts. And they never spoke to my partners. I'm the doctor. My 2 partners were business guys. They handled all the money. They never spoke to them, and they still haven't spoken to them. In medicine, when you see a patient, you submit for insurance to the insurance company. You submit the patient's name and a bunch of codes. That's all you submit. You don't actually submit a chart. If they want to see the chart, they have to request it. They requested the charts, but not until after they indicted me. So they were basically saying we were upcharging. Our codes were too high, but they wouldn't have known that because they hadn't looked at the charts.
So it's the shoot first, aim later.
Right. So actually, it's funny you say that. The judge on my trial, who's the chief judge of the state of Maryland, actually called out the prosecution in a pretrial hearing, and he said to them, "This sounds like a case of, quote, shoot first and ask questions later," end quote. And he said it because it's exactly what it is. They didn't do any real, investigation. They subpoenaed my Yahoo email account, but not my business email account, with which I used to communicate to all of our providers, our nurse practitioners and PAs. So anyway, we took this to trial because I did nothing wrong, and I wasn't going to, raise my right hand and commit perjury by taking some plea deal that said I did something I didn't do, and then lose my medical license and spend time in jail anyway. So I said, I'm going to fight this. So I did. And the first day of trial, the government puts up this quote unquote expert, and he knew nothing about anything. And it was so bad that the judge actually dismissed the jury to the jury room, called us up to the bench, and again, this is all in the public transcript, so it's all, you can see it for yourself. He waves his finger at the government and says, "What the hell are you doing? Where's the crime here?" And the government, "Oh, you'll see, Judge, it's coming," and blah, 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 blah. And the judge said, "I am about ready to toss this case out right now. You better show me something soon." And they said, "Give us time, Judge. We'll show you something. We'll show you." So then the case progressed for another 2 weeks. And at closing, which is something that's just mind-boggling to me, that the government gets to go last. And they're the ones bringing charges against you. So in my opinion, you should get to go last to defend yourself. But they get to go last.
First, they
go first, then you go, then they get to go last.
Yeah.
Which is crazy to me. But anyway, so they get up there, and everything that they had said that I did had been really just shot down, and all their their theories of fraud basically were completely obliterated by my attorneys with just facts. And they presented no evidence, zero. So we were billing at a certain level called the level 4. And there's good rationale for that, which no one ever asked me. All they had to do was pick up the phone and say, "Hey, could you explain why you're billing this way?" And I absolutely would have been happy to, but they never gave me that opportunity. And they never said why what we were doing was wrong. They never said what the right level should have been. They just said I was wrong, which just blows my mind.
Billing work. I'm assuming during a crisis, the billing goes up. I mean,
No, it has nothing to do with that. There's a chart, and you basically go through the chart, and if it matches up certain ways based on certain criteria, that's how you bill. And I must have gone through that chart 100 times. And I even went on the American Association of Professional Coders website. They have a tool that helps you do that. And I went on their chart, their website 100 times, and it came up the same way every time. And by the way, I wasn't seeing any of these patients. The nurse practitioners and PAs who worked for me were. Yeah. And I put out emails saying, "This is how I think you should bill," but they were free to change it, and they testified that they could change the coding if they wanted to. So I wasn't holding a gun to anybody's head saying you have to bill it this way. And at the end, which is just mind-boggling to me, the government looked at 5 total charts out of over 100,000 patients that we saw, and they alleged fraud. They looked at 5, and they never had a professional coder look at those charts, just the government attorneys who know nothing about coding. We hired a professional coder who testified at trial that everything was done appropriately. In fact, he said a couple of charts may have been undercoded. And he was So anyway, last day of trial, the government gets up there and they say that the head prosecutor says to the jury, he said, "You may be asking yourselves, jurors, what the appropriate level is. Should it be a level 2, a level 3, a level 4? It doesn't matter." These are his words. "It doesn't matter. You don't need to know. All you need to know is that he's wrong," meaning me, "and he's a criminal." And then they said, the defense put up these charts and they had an expert testify, and it's all very confusing. But they're just trying to confuse you. Just use your common sense. Does this make common sense to you? Juror number 1 and juror number 2 and juror number 3. Does this make sense to you? Is this common sense? Use your common sense. And of course, if I'd been able to rebut that, or my lawyer had been able to rebut that, the very simple rebuttal to that is, has anybody in here ever filed a tax return? Do you think it's okay to call the IRS and say, "Hey, IRS, I used my common sense. I didn't follow your stupid, complicated rules. I used my common sense." How is that even an argument? Yeah. And what's amazing is the government and the AMA wrote those rules. And what's amazing to me is the AMA, I'm not even a member of the AMA. I've never been a member of the AMA. They wrote an amicus brief to the court saying that I didn't break the rules that they helped write. And the government still came after me. So anyway, I get somehow, I just don't understand how, but the jury finds me guilty. Worst possible day of my life. I wanted the earth to open up and swallow me whole, and I wanted to just die right then and there. So I had to go home and tell my kids this. That. Yes, I know. We all share that common bond. It's a fraternity I never wanted to join.
Yeah,
so anyway, it's horrible. So for the next 4 months, I'm living in this horrible pain of thinking I'm going to miss the rest of my kids' lives. I'm facing 50 years in prison for doing something I never even would contemplate doing, and that they never proved that I did. So, and I'm thinking, oh my God, my kids are young. I have 4 kids. I'm very close to them. I'm not gonna be able to see them go to college. I'm not gonna be able to see them get married. I'm not gonna be able to see them the first day of my youngest, this first day of first grade of kindergarten. I'm gonna miss all this stuff from their lives. And then a couple of days before Christmas, The judge issued a 93-page opinion, and he acquitted me, and he granted me a new trial in case the government appealed. And he said such things as, I mean, it was 93 pages, just to put this into perspective, is way more than the Supreme Court writes. This was a thick, very well thought out, very thorough castigation completely of the government's case. And he even said things like, quote, "There can, of course, be no crimes if the defendant complied with those rules," end quote. Quote, "The court, having closely observed the testimony and parsed the evidence in this case, concludes that the evidence weighs so heavily against the verdict that it would be unjust to enter judgment," end quote. Quote, "The government did not carry its burden and no reasonable jury could have so concluded," end quote. I mean, it's just 93 pages of that. It goes on and on and on about just, how bad the case for the government was. And literally on their way out the door, as at the last hour that they could, and as they're packing their bags to leave because of the inauguration of President Trump, the Biden DOJ appeals, and somehow I find myself being dragged back into court now in August. I have a new trial, which and by the way, it was supposed to be the same judge who was the chief judge of the state of Maryland, Judge Bradar, who wrote this very courageous opinion, was supposed to adjudicate my trial.
Yeah,
and he just a couple of months ago wrote a one-line email to us saying, "I am recusing myself from your case." Now, in my mind, there can only be two reasons for that. One, he's getting pressure from somebody. Now, I don't think that's the case, because anyone who's courageous enough to write a 93-page opinion, I don't think would put up with that. But number two, I think he feels so that this case is such a bunch of BS that he doesn't feel like he can be at all objective to the government. So I think he decided to recuse himself. Now, I haven't spoken to him, but that's just my opinion.
Do you know who appointed him?
Oh yeah, he was an Obama appointee, and even he came and pointed out how stupid this case was and how ridiculous this case was. So, in order to prove "quote unquote" intent, criminal intent, what was their evidence? Their evidence was emails I sent to the providers explaining evaluation and management, E&M coding, which is what they're alleging that we were mistaken for. And I said in those emails, I said, "This is our bread and butter." And you know what? It's the truth. It is our bread and butter, because if you look at doctor's offices, non-surgical doctor's offices, that's about how you make 90 to 95% of your income comes from E&M coding. So how was that in any way nefarious? But the government made it seem like I was the worst person on the face of the earth and I was some criminal mastermind because I kept using the term I probably put it in 3 emails, but they just kept putting it in front of the jury. It wasn't even in the indictment. Bread and butter, bread and butter, bread and butter. I'm like, this is your evidence? You're willing to ruin somebody's life over that?
Yeah.
And at worst, this whole case is really just a billing dispute. You think it should have been a level 3? Okay, I say it's a level 4. Fine. Let's sit down and let's discuss it. That's not a criminal enterprise.
That's a civil. But
at worst, it's a civil case. So. Yes.
The government should issue corrective action, especially on uncharted territories you were at.
Yeah, I mean, we were trying. Look, the other thing that's crazy to me is, I was literally putting my life on the line every day. The nursing homes, for example, were hotbeds of death and destruction. I mean, people were dying by the boatload. So early in the pandemic, I set up a boat teams of people, myself included, who would don PPE, go into the nursing homes, test people so we could isolate them, staff as well, so we could put the people who are sick, isolate them and isolate the staff and save people's lives. The people who are coming after me were hiding in their basements. The governor of the state of Maryland personally issued me a citation for all the work I did during COVID. It says, for your courageous activity during COVID. The state legislature gave me a personal citation for that. And even after I got indicted, the State Medical Society named me its Person of the Year for all the work I did during COVID. And the federal government tries to ruin my life. It's just mind-boggling. Like, of all the good things that we were trying to do and save the people's lives. And then the other thing is, if you think about how much money we saved the system by all the people that we saved and then isolated from contagion, from potentially infecting other people, we're talking probably close to $1 billion of savings to the system.
You see the money that was going to wind up in some politician's pocket. And some
that's true. You're right.
Yeah, I mean, I tell people all the time, if something doesn't make sense, track the money.
Yeah. I feel like, I don't know how you guys feel, but I tell people this, and it's the truth. I feel like when I tell my story, like I have some kind of like tin hat on my head, and I'm talking about aliens at the pyramids of Giza, and I'm like this, but it's the truth. Like, this is all real. This is like, it's fact is stranger than fiction. And I'll give you one more fact is stranger than fiction. So a couple of weeks ago, I get invited to the Department of Justice to go and speak at a roundtable discussion about weaponization. The people who are trying to throw me in jail invited me as a guest to come speak about the very thing that they're using against me. Like, you cannot make this stuff up. It's just, it's mind-boggling. It's just crazy.
It's
Come by and tell us how we could do better, quicker, to make up more shit to put you in jail.
Yeah.
Let me ask you another question, being that I went through it. How much evidence did they suppress that would probably fully clear you up in that case?
Well,
yeah.
It's a fun,
I mean, I don't know. I keep reading and hearing stuff, and I'll listen to a lot of other podcasts. And I mean, I even heard like Kash Patel when he took office for the FBI, and it's just like, there's just so like many districts and people against change in these other offices. So, I mean, yeah, I can understand how you went to DC to talk there, but what affiliate, like what control do they have over some unchecked power in another district? And how hard is it going to get to change that? Like,
yeah,
I mean, he said like on Joe Rogan, he's like, it's a fucking shit show. Like, I have people just doing stuff opposite of what we are telling them to do because they're just loyal to the blue, you know?
And there's no ramifications to them. There's no accountability.
Oh, no.
That's the worst part. Like, they can just, I'll give you another example. So during my trial, they violated HIPAA again and again and again and again, to the point where somebody complained that was in the gallery because the government put up the person in the gallery's personal information for the whole court to see, which is now public and for public record. If I had done that, not only would I lose my medical license on the spot, but I would be facing another charge because that's a criminal offense. But yet,
probably wouldn't be here. You probably wouldn't
the
be
judge
here.
had to tell him to stop. They had, judge, he said, government, you guys, you have to. There's a rule called HIPAA. You guys need to abide by it. And I'm like, why are they not held to any standard? Why can they just violate the law?
Well, yeah, I mean, it's because,
but they can. So
yeah,
and
that's a bigger change that needs to happen because, I mean, I feel like any of these prosecutors, if they're proven to lie, that they should be indicted or charged and basically lose their licenses too. But they're not held accountable.
No, not in any way, shape, or form.
The agents come out and interview people. I mean, when you get pulled over for a speeding ticket, the CHP or the officer is wearing a body cam, but federal agents aren't wearing there's no accountability.
It's funny you say that because I was just talking to someone about that. I find it interesting that like the FBI is really the only, as far as I know, the only law enforcement agency that doesn't record its interviews. They just take notes. And then they give you these, during discovery, they give you these 301s, which are like the notes that they take. But that's the agent's interpretation of what happened. That's not the actual thing that happened. It's just the agents taking notes. Like, why can't they just record them like everybody else? If you went to the local sheriff's department or you got arrested or whatever, they would film that. They would record it.
Yeah.
But the FBI doesn't do that.
I think it's because, I mean, look at the conviction rate. It's 98%. That's why, because they know if they have those recordings, it's going to get used against them, and they can't bully. I forget what the actual percentage rate of people that have to plea. But
it's ridiculously high because, and a lot of those people are totally innocent. The other thing is people don't realize that, they will crush you like a bug, and they keep crushing you like a bug. And you're talking millions and millions and millions of dollars to defend yourself. You guys know this. And, they know that, and they know that they can outlast you because they have unlimited resources and they have the full weight of the federal government behind them.
And they buy as much as they want. They can bid press you all they want from day one of a made up indictment. I mean, it's ridiculous. It's you're supposed to be innocent until proven guilty. No, you're guilty 500 times over, and you have to prove yourself 18 billion times innocent.
Innocent, yes. And then, of course, anytime you show up before a jury and they say it's the United States of America versus so-and-so, well, that has a lot of weight too.
Yeah.
The person sitting in that jury box is like, the United States government is bringing charges against this person. There must be something there. There's a reason that they brought charges. So that you're automatically at a disadvantage. And then the other thing I don't understand is, I don't know what it's like in your districts, but I'm assuming it's the same. The courthouse, the government is in the same courthouse as the judges, the
Oh, yeah.
government's offices. How is that fair? Your defense attorney's offices aren't in the courthouse next to the judges. So when they go downstairs to the cafeteria, oh, hey, Judge so-and-so, it's nice to see you. You don't think that has some bearing on like how things, I'm not saying that the judges get swayed, but come on, if they see them every single day, that's got to have some sort of an impact.
When I forget
the judge worked as a fourth prosecutor, basically.
Well, and most of them were former prosecutors, and sometimes in that same district, which I don't know.
He was like, when they were veering and like losing, he'd find a way to like chime in and clean it up for them.
See,
they lost every day.
Yeah, I'm lucky because my judge, I think, took the opposite approach. My lawyers kept telling me that they thought that the Judge Berdar thought I was guilty, but so this was completely. I never really got that impression, but they were, oh yeah, he thinks everybody's guilty, but. He was so courageous. And I think he just realized that this case was so stupid and so meritless, but yet they brought it anyway, because I think it's pretty obvious that they did it because they wanted to shut me up and they didn't like what I was saying publicly. I mean, there's no other explanation for why they would have brought such a meritless case that the chief judge of the state of Maryland said was meritless. And then the Fourth Circuit said was very weak. So now you have two courts saying that this case is bad. It's just I don't understand how they do this and how this is a good use of taxpayer funds. But I think the scary part that everybody should be frightened about is that okay, so they came after me and they came after you guys, and okay, fine, so we're just three guys, but they came after the president of the United States using the same bunch of nonsense. If they can do it to him and they can do it to the three of us, why wouldn't they do it to you? Yeah, that's what everybody should scare everybody, because
everybody should be scared of. They'll do it.
Yes,
they could do it to the lowly farmer that owns land, and they want to give the land to their friend who's a politician, and they want to take acres from him. And the minute he complains about it, they go arrest him. Right? At least.
Yeah.
Well, I know Elon Musk said it. He said it a bunch. Like, they just need a target, and then they'll create the crime.
Yeah. I mean, that's like that famous quote from Stalin's chief of security. It was, show me the man and I'll show you the crime. Yeah. I mean, that's essentially what they're doing. And it's like, it is the most un-American thing there is.
Dylan died a ham sandwich. Chuck Schumer said Dylan died a ham sandwich.
Yep.
And, it's crazy. It's so crazy.
Yeah, it is. It really is. It's just, and it's the most un-American thing that there is, because you're weaponizing, ruining people's lives, their families' lives, and you're weaponizing an institution that's supposed to be above and beyond all that. And you're taking it and you're just completely destroying it and using it for nefarious purposes. And that's beyond reprehensible. It's horrific.
The integrity's gone, basically.
Completely.
And unfortunately, the average American, and if you would have told me this in 2019 before my family started this whole bullshit journey, like, I would have said probably the same thing that you were you kind of saying, how juries are like, well, if the government thinks they did something, I'm sure they did a lot of research and investigations, and they're probably guilty.
I would have said the same thing.
Through it, you're just like, oh my god, like, I can't believe it's happening.
Sorry, Chris, I'm going to cut you off. I was going to say, to that point, though, there's two things that could be possible. One, incompetence, and two, nefarious activity. Or it's a mixture of those two things. Those are the only three possibilities. And I personally believe that there's a mixture of those three. I think that some of these people are completely incompetent, and there's definitely nefarious undertones, certainly in some instances. And those two things, they come together and they just make this horror show of what they do, and it's just completely beyond the pale. And it's ruined your two lives, it's ruined my life, it's ruined my family's life. I have 4 little kids. They're they all paid the consequences of this, of something they didn't do. It's lives. Yeah.
Well, and it takes away, and I feel this can work in all 3 of our areas, and I can give some good examples. Like, for you, Dr. Ron, like, there are still people that have done stuff illegal or bad in the medical business or in the financial world or even in my world in PPP. Like I remember seeing people buying Lambos that worked at Taco Bell, or for example, in the world of, like, for you, Mike, like the Wolves of Wall Street movie. I mean, holy shit. Or for Ron, like, what's the doctor that was prescribing the stuff that basically killed Michael Jackson? So, I mean, there's people that need
are
to
committing real crimes. Yeah,
be held
absolutely.
accountable. But it's
100%.
starting to lose its lack of luster, for all words, or integrity, where, like, now people just don't know, like, is it a real one or is it a fake? Is it lawfare? Like, and there's like how you mentioned everything with Trump and all the bullshit they put him through for basically saying that Mar-a-Lago's only worth what, like $17 million. Like, I'm like, come on, like, it's ridiculous.
Yeah, absolutely. It is ridiculous, and it's awful, and it's terrible, and they shouldn't be allowed to get away with this kind of stuff. But again, unfortunately, it's kind of the way things are now, and they can get away with it, and there's no repercussions to them. That's the worst part. They can completely destroy your life, and even if they walk away from your case, right, and say, "Oh, sorry, we're dropping the charges," they never apologize, and they never give you your life back.
No, and it's all about, especially if they start getting into too deep and they realize there's, this case isn't strong. That's when they start doubling down and tripling down, because it's the worst thing for a prosecutor, from what I read, to drop a case. I mean, that, especially if they're trying to work their way up that ladder. And I think I'm speculating because I don't want to get in trouble, but I'm pretty sure every prosecutor, their goal is to be a judge one day.
Or get a job in private practice for millions of dollars. And what are they going to say? Oh, look, I successfully prosecuted these 10 people, and and that's it, right? And they don't care who they screw over. Like, I mean, my case had 3 libtards, had a lesbian and two gay lawyers coming at me, and all they did was parade my lavish lifestyle, right? Because they went through my wife's Instagram and my Instagram. And okay, so you got all my trips to Mar-a-Lago, and you got all my pictures of, Let's Go Brandon stuff, and Obama first night, and all these other stuff, right? That we both had, because we would nobody thought that anybody was going to come after us for Instagram posts and joining a Trump property and such things that you would never expect.
Right.
And yet they did it. And if the other idiot would have been president, we all wouldn't be here. We'd be mates and discussing it.
Yeah, thank God that, exactly right. Thank God that he won the election, and that they're trying to clean this up and, bring some accountability. But it's a long slog, and there's a lot of these cases. And, and I think I'm painting with a broad brush. Obviously, this doesn't include everybody, but I think in general, these prosecutors, their goal is a win. And they don't, to your point, Mike, I don't think they really care about justice or about anything else. It's just, I want the W, I want the win. But it's not supposed to be about that. It's supposed to be about what does justice tell you? It's like in my field, if you walk in with chest pain, I'm gonna it would be like, all right, this guy's got a heart attack. Well, maybe you don't have a heart attack. I got to think of other things too, and I should be open-minded about that. And I should look at what is the truth. What does this person really have? What is their diagnosis? It's the same thing. It's like, what is is there a crime or isn't there? And if there isn't, then they should say that. But I don't think they have. A lot of them just don't. They don't care. They just want that win.
The comparison to your field is, you went into that courtroom with a heart attack and they replaced the ACL to say that you did just to make something else up out of nowhere. How is the jury selection for you? Is that like, because I don't know, in mine, when they had that 35 jury selection, there was at least 6 or 7 that were familiar with financial stuff, probably would have understood this better. And those are the ones that the AUSAs did not want.
Of course.
Right? People that understood my business model, they did not want. Did you have that too? Anybody?
I think there was one physician's assistant in the group, or a nurse practitioner, I can't remember, and the government gave her the kibosh.
Right.
Same thing, which is crazy, because a jury of my peers really would be somebody who understands what I do for a living. I'm not bashing the jury system, but I'm just saying that, like, somebody who stocks groceries, nothing against that, but that's not really my peer. Um, because this is complicated and they don't understand it. And I'm, again, not knocking anyone who does that for a living. I think it's very admirable that you have a job and you can do whatever you do. But when you say a jury of your peers, like specifically when you're talking about something that's relatively complex, and I believe that the government won because they basically were like, use your common sense. But that is the stupidest argument you could ever imagine. But that's what they said. And again, they didn't care about the facts because they had lost on the facts. They just went with use your common sense, which went against the very rules that they were saying I broke, which I followed. Like, in fact, at one point they were cross-examining my witness, who was the professional coder, and they were just lambasting him for these rules. And he looks at them and he says, you know what? You may not like these rules, but these are the rules, and Dr. Elfenbein followed them. Like, just because you don't like them doesn't make them illegal. Like, those are the laws. Those are the rules that you, the government, put forth. And now you're saying that we shouldn't follow them because you don't like them? Like, what kind of stupidity is that?
Yeah. So
you're the government, change them.
Right, exactly. Change them, right. That's right.
Yeah, change that statute. The fucking word I hate.
Yeah, I know. I know it's.
So you're going back in. Are they trying to charge you with the same charges, or did the government tweak them to try and get their win a different way? Because I've heard they do that sometimes.
I don't think they can tweak them. I think it has to be the same. And the new jury cannot find out that there was a prior trial. Otherwise, it's a mistrial. So I'm not really sure how all that works. We've talked about it. I still don't really understand it. Like, I testified at my own trial, which, again, most defendants don't do, but I did because I was innocent.
It will add more time. That's what your attorneys love to tell you too.
Yep.
Yeah.
But I did it because I didn't do anything wrong, and I thought.
Will crush you.
Yeah.
Don't do media, which is also, because don't make them angry. Don't do media. Don't make them angry.
Right. But which is also crazy because, like, your constitutional right is to defend yourself and to get a trial by your peers or by jury. Why should they tax you for that? Why should they add on that? By the way, so the listeners, they do that. They, Chris, to your point, like if you defend yourself and you go to trial, they add a trial tax. They add more time to that because you, quote unquote, wasted the time of the court. But, like, that's your right. Why should you get in trouble for exercising your constitutional right? I don't understand that. I think that that's also reprehensible. Like, why should they, look at that as a negative? That should be a positive. That's the way the system is supposed to work. You, as the individual who's being charged with the crime, have every right to defend yourself. It shouldn't be held against you because you wanted to defend yourself. It's just like the system is just, there's so many things that are screwed up with the system.
Yeah. I mean, even the fact, and I've talked to some of the other doctors that are in this little group of ours, and they've gone through it and served time and lost their license, even though it was over billing. And that's just like, it doesn't make sense. I mean, I could understand if you're a doctor and, like, the Michael Jackson thing, like, you killed somebody for being irresponsible, stuff like that, you should lose your license. But to lose a license over a billing issue that had nothing to do with what you do day to day, and they don't do that to attorneys. I'm pretty sure attorneys can get their licenses back who have been convicted.
Yeah, well, to be perfect,
in the other world of medicine, and even I don't think you can even become a real estate agent. Like, to
be perfectly fair, and I'm just telling you. So the federal government has nothing to do with medical licensure. That's the states. Yeah. So each state has rules that if any, I believe it's the moral turpitude. So crime of moral turpitude, if you're found guilty of, they take your license away. Every state's different, but so, like in Maryland, they would have taken my license away. They never did because I was just charged with the crime. I was never actually found guilty. But if you are found guilty, that would automatically be revocation of your license. But I just, to your point though, the majority, like, fraud in medicine is usually pretty clear cut. It's like a guy like, this is an actual case. A guy was in England on vacation, billing Medicare for patients that he was supposedly seeing in his office in whatever state he was in. I don't even know. And he was clearly in England. They had his plane tickets. They had pictures of him in a restaurant. They had his hotel reservations. That's fraud. but the government never alleged that any of the patients that we claim to have seen didn't get seen. In fact, they called 3 of them as witnesses, and they all raised their right hand and said, oh yeah, I was seen. I got seen by a provider. I got my nose swabbed. I got my test results. They took my vital signs. Everything we said we did that was done. They never alleged like ghost patients or like we're trying to, that's fraud.
Oh,
what,
yeah.
what they're alleging isn't even fraud. It's just a billing dispute. And it was just on 5 charts. Like, I can't believe that they're going to extrapolate that to 100,000. They only looked at 5. Like, what statistician says that makes any sense? Like, it's the whole thing is just so fraught with nonsense and ridiculousness that it's just beyond the pale that anybody would think to bring a case like that's reasonable. And that, oh my God, I got such a good case here that this is clearly, look, this guy's ripping the government off. Like, really? Your evidence is that I put out an email that said bread and butter, and that you looked at 5 charts and you never even had anyone who knows anything about coding look at those charts. Like, that's your case, and you're going to ruin my life over that and bankrupt me and ruin my family's life.
I've had friends use that terminology, bread and butter or mailbox money, on businesses they're running left and right. Because
it's accurate, right? It's an accurate description. Yes. It's just, but again, I'm not alone. You're not alone. Michael, you're not alone. Like, there's a lot of people like us out there that they've
They'll
come
clip
after.
one phrase out of every case.
What's that?
With us, it was, they quoted me on everything. So when COVID, I supervised some of my guys in Manhattan, and we had the offices. But the COVID came, we moved to Florida, so everybody wanted to. All my referral agents wanted to open their own little office or whatever through the success of the company. And one guy, I get an email from a screenshot of an email that he's emailing people that he's the fund manager, right? Like no, me, Brian, and Fran run the fund. Like, it's not the manager. So I flipped out, and I texted Brian. I was texting Brian. I go, look at this email. An asshole regulator, because I was fired up. I said, an asshole regulator would have a field day with this. Right? Me being angry about it and being compliant about it, right?
Right.
No,
trying to do the right thing.
It's like me. Oh, I'm trying to suppress everything. You have all my tax. We were an exempt reporting advisor, and we gave everything to the government, and it was nuts how they just twist everything you say against. They'll look at 5,000 texts and cherry pick 3 and make a story out of the whole thing. That's right. What they said here. It's
right.
Nuts. It's so.
He's
nuts.
evil. He's terrible. I actually said to my wife during the trial, I'm like, if I could have literally single-handedly cured cancer, and the government would turn around immediately and say, well, yeah, he is. He cured cancer, so he can make millions of dollars. Like, I'm like, really? Like, no matter what you do or say, they just turn it around. And in my case, like, the indictment, they indicted me. They said that we weren't spending enough time with our patients, and that none of these tests were medically necessary. Now, you think that through for a second, that the tests were not medically necessary during a pandemic when the government was saying everybody needs to get tested.
Well, when I was Lysoling my fucking Instacart orders, I mean,
right, exactly. So their own expert, quote unquote, expert witness, the guy I was telling you about before, he got up there and he testified under oath that not only was every test medically necessary, but time is irrelevant. In direct opposition to what they indicted me for. 100% opposite to what the indictment read. Their own expert testified. Like, you cannot make this stuff up. Like, it is just, either there's nefarious intent or incompetence or a mixture of those two things. That's all there can be. Like, it's just beyond. Again, I get so worked up about this stuff because they ruin people's lives over this. And you would expect, as you said before, Chris, like, that these people coming after you would be like ironclad, and they would say, look, we got all this evidence and this person's a bad person and they should go to jail. And for those people like Tony Soprano, yes, they should go to jail. But for other people like you and myself and other people who are not Tony Soprano, who didn't do anything wrong, like, leave us alone.
Yeah. And I've said this before. I feel like a lot of these white collar so-and-so crimes that are financially based or whatever, the government makes over $1 billion a year in forfeitures, and that money is really not accounted for from what I've dug up. So I mean, there, like I said, everything kind of points to money. It feels like, and even COVID. You hear all this stuff now, and I don't know how you feel looking back on the past 5 years, especially with, I mean, just the way things were handled, Fauci, like all that kind of stuff. Like you were in the weeds, and like looking back now, like just your thoughts on like how they fucked up, basically.
Tremendous incompetence. And then once again, I'll go back to my branch point. It's either tremendous incompetence or nefarious intent or a mixture of those two things. Those are the only three possibilities. And in the case of Dr. Fauci, certainly lots of incompetence, but I do believe that there was some nefarious intent there. Call me conspiratorial, whatever you want to say, but like I do believe that there was some ill intent for people there. And all this evidence is coming out. I mean, all the 6 feet, like completely made up, right? The fact that when you went to only Walmarts could be open, but your mom and pop shops couldn't be open. Well, explain that one to me, or explain that when you went into Walmart, they had arrows going up one aisle and going down the other aisle because like the virus doesn't move in two directions.
To eat.
Right, exactly. Or like, God forbid, you should be able to go to temple or church or to a mosque to pray, but you could go to a George Floyd rally. Like, how does that make any sense?
Or here they were arresting people surfing in the ocean by themselves.
Right. In the sunlight.
No
right,
way,
which kills viruses. Right. Yes. Yeah, they were.
Or in California, we're special out here. So special.
It's amazing. Bricks the windows in Fifth Avenue. They weren't carrying COVID.
Yeah, I mean, the level of incompetence was ridiculous. I mean, it was just one thing after another of just, you want to use the term misinformation, malinformation, whatever, and you still have people that are so gung-ho, well, I'm going to believe the establishment. I'm going to believe what they have to say. I'm not saying that everything they said was wrong, and I'm not saying everything they did had ill intent, but clearly a vast majority of what they were doing was to fit the agenda of everybody gets a vaccine, everybody, which, from a newborn infant to a 90-year-old, nursing home person. Why? Like, explain that to me. Why does everybody need to get a vaccine?
I mean,
my wife and then a booster, and then another booster.
The first round, and then after more info. I mean, I never even got COVID. My wife got it early. Like, I think it was like early February 2020. She was down for like 2 weeks. She's never had it. And me and the boys never got it. And we never had the kids because you heard about all the heart stuff, especially for kids. So we were like, they're not getting it. But then just you hear more stuff, and like, especially, I mean, you said I obviously haven't been in medical school for a while, so I'm sure you kind of, I don't know if lived through it, but obviously knew, like, and you hear more about it. And a lot of Americans don't know Fauci's role in the whole AIDS epidemic.
That's where he became,
and everybody, it was horrible. Like, people were dying left and right with this shit. I mean, there's a movie made about him. JFK Jr. or RFK Jr. like has a book about him. Like, so it's just, and like 10 years, everyone's going to say COVID, and you and I are going to be like triggered for 5 minutes, like PTSD.
and I don't know about you guys, but like, again, the allegation for me is fraud, and we owe all this money, but like, I drive a Hyundai and my wife drives a beat up Subaru. Like, we don't live lavish lifestyles, but the government, you listen to them, you think I have like Tony Soprano in my ceiling tiles. I have stacks of cash hidden, and again, to go back to they brought 5 counts against me. Each one of those counts was a patient that was seen in the clinics by my nurse practitioners. I didn't even see him, which is crazy. But so if the government says, okay, well, we were billing a level 4 and they think it should have been a level 3. Okay. The difference between those two levels in terms of billing is probably anywhere between $20 and $50. So let's say $50. So multiply that by 5. It's $250. So you're going to throw me in jail for 50 years over $250? That's what you're going to do? Like, that's reasonable? Who thinks that's reasonable? In what universe is that reasonable?
Not in common sense world.
You would be
in government or AUSA common sense, and that's probably how they use that phrase for the jury for you, like how you said, use the common sense, but that's their skewed version of winning common sense, like through rose-colored glasses.
For the sake of being conspiratorial, you were going to stop the vaccine. And if you want to go down the rabbit hole, I've read so many things that COVID was coming no matter what. Whether Trump was just like the bull in the china shop that messed up their whole master plan because they were 100% betting on Hillary being president, and the vaccines were already produced, and this was ready to be mass rollout to make us into good little soldiers. And he came out and he opened everybody's eyes on how corrupt the government was. And I'll never forget February 18th of 2020. I was in my living room watching on TV. I go, honey, this is how they're going to steal the election from him. And that was it.
Mm-hmm. Yeah.
And that was it.
Yep. You're right.
I stood up. I was angry. I was in my living room just watching it by myself. Obviously, because we're in New York. We're trapped, right? So it's like school's going nowhere. My kids are like learning nothing on
right. Virtual learning. Yeah, it's ridiculous.
Yeah, we all turned into teachers.
Yeah. You get it back to your Lysol into them. I used to go get the mail, and my wife used to make me take my clothes off in the garage to go back in the house.
Yeah, I mean, I was working in ER. I actually volunteered to work extra shifts during COVID because, again, like the ERs were like nobody wanted to work, so I picked up extra shifts, and I would do the same thing. I'd come home, and I would, like, my kids wanted to come hug me. I'm like, no, stay away. I'd be in the garage. I'd have a whole procedure where I'd take my clothes off, throw them in the washing machine, and then immediately go shower before I would say hello to anybody. Like, I had a whole process. Like, it was crazy. But I think from a global perspective, my case in particular, when the government comes after like somebody who's trying to do the right thing in a pandemic, right? A physician in a pandemic, what kind of message is that sending for nonsense, right? If I was legitimately doing something or hurting people, of course, come after me and throw me in prison. But for something like this, which is at worst a billing dispute, which easily could have been resolved. And by the way, that's how it's supposed to work. And even in their own rule books, in Medicare and in the insurance company rule books, that's what they're supposed to do. They're supposed to solve this civilly. But why would anybody step up and do this again? Like, why would anybody, next time there's a pandemic, any doctor put themselves on the line, put their life out there on their line, because you're going to get shafted by the government and they're going to try to throw you in jail retrospectively? Why would anyone put themselves in this position?
But that's what they want. But that's they want you to be obedient, not a guy who actually wants to help people, unless you're going to do it. And Pfizer's going to make all the money, and the government, the money's going to get passed down and washed down to the centers of the other people. That's the problem, in my opinion, because it's all about money. It's all about stealing. This country doesn't have a deficit; it's got a fraud problem.
Yeah, that's a good point. But I'll tell you, like, I have a friend of mine. He's a plastic surgeon out in Connecticut. He's a dear friend of mine, and he doesn't. He used to just do Medicare because he would lose money on those cases, but he took them because he wanted to help people, and he wanted to, like, little old ladies or little old guys that got burned or that had mastectomies and they needed to have their breasts reconstructed, whatever. He wanted to make them feel better, and he wanted to do the right thing. And he's like, look, I lose money on these cases. It's not worth it for me, but it makes me feel good. After what happened to me, he's like, screw that. I'm not taking any insurance. He dropped Medicare right then and there, dropped all insurance companies. And that's happening with more and more commonality because doctors realize, like, just how fucked up, excuse my language, but how the system is and how wrought with. So the insurance companies were just accused, and they admitted to this, of automatically downcoding. So they accused me of upcoding. The insurance companies are automatically downcoding. So when doctors' offices submit claims, they're automatically just denying them and saying, you're billing too high, we're going to pay you less. The onus is now on you to prove that you're right. They're automatically doing that. It's just automatic. You say it's a level 4, we say it's a level 3. They haven't even looked at the charts. They're just automatically downcoding. How is that legal? How do they get away with that? That's stealing. They're stealing intellectual property from the physician who did the work, and they're just stealing it. But they get away with it every single day.
Yeah, I remember when I was a kid, and my dad he's retired now, but he would do a different heart surgery or whatever, and they knew the song and dance with the insurance company. So, we bill it for, I'm just making up numbers here, but like $250,000, because we know when we do that, they're going to pay us $50,000. So because if we billed them for $50,000, they're going to give us $5,000. And I don't know if that still goes on. Obviously, this is in the 80s when I would remember hearing my parents talk about just dealing with insurance. And I mean, Aaron and I have a gym now, and we get hit up by a lot of people. Hey, you should do the different programs with like the insurance companies, so then they'll pay for my gym membership. And I'm like, I don't even want to touch that.
Yeah, no, you're
Like,
smart. So what you're speaking about, Chris, is when you set up a fee schedule. So what happens in doctors in the medical world is the insurance company pays you what they pay you. Medicare, Medicaid, Blue Cross, doesn't matter. They will pay you what they pay you. There's no like, well, I'm going to charge $10,000, but you're going to pay me $10,000. No, the insurance company is going to pay you what they pay you, and everybody gets paid essentially the same. Certainly with Medicare, they do, but you have to create a fee schedule. The insurance companies are smart. They say, we're going to pay you in your insurance. When you sign on the dotted line to become a member of Blue Cross, for example, a provider in their network, they say we're either going to pay you what is usual and customary, or what you put on your fee schedule, whichever is the least. So you don't know what's on their fee schedule because that's proprietary. They won't release that to you. So what happens is you have to inflate your numbers, because if you don't, then they're smart. They're going to say, well, all right, we would have paid him $100, but he's only put it down for 75. We'll pay him the 75. So instead of putting 100, you put 150 or 200. Those numbers are meaningless on your fee schedule. Doesn't matter what you put down, because to your point, Chris, they're going to pay you what they're going to pay you. But you have to inflate those numbers, because otherwise they're going to screw you over.
Yeah.
But the numbers are meaningless. But that's where those numbers come from. So to your point, the people look at those things on their EOBs and they're like, oh my God, where's this? But no one ever gets paid that. You have to put that ridiculous numbers down, because otherwise the insurance company will pay you nothing.
Yeah, and they would love to do that.
And they would love to do that. Correct. Yeah, it's a messed up system, and they get away with it because they're, by government fiat, like most things, by government fiat, they're allowed to get away with essentially theft.
Yeah. So through all this, like, how has home life been?
Well, it was miserable. Like, I'm sure you guys went through the same thing. I couldn't sleep for 2 years. I was a wreck. I mean, I didn't want to answer the phone. I didn't want to answer the door. Every time I saw a black sedan drive by, I'm like, oh my God, is it the FBI? I literally, like,
federal plates on it.
Yeah. And, I was, to lack of a better term, just scared shitless. And I was a shell of myself. I'm a very outgoing, very personable, gregarious kind of person, but I was like a coward cowering in the shadows. I was miserable. They had squashed me like a bug. And then I got that acquittal. And I tell you something, that night, for the first night in almost 3 years, I slept like a baby. And the next morning I woke up, and that whole like heavy weight that you just feel all the time had just evaporated. Yeah. And then I watched as that weight was put back on my shoulders, and I just the worst possible feeling. Like, my kids had to, all three of them. Well, the youngest one was 3 at the time. So the other 3 were old enough to understand what was going on. All had to go into therapy. They're all well-adjusted straight A students, but they all had to go into therapy.
That's how one of them, my oldest son is too. He had to go in.
Yeah. One of them, my daughter, she wouldn't leave my bed. She slept next to me for an entire year. Even though I just sat there and stared at the ceiling, but she would sleep right next to me and wouldn't leave. So it's brutal. It's horrible with these. They don't care that they just ruin people's lives for over nothing. Again, if you commit an actual crime and you deserve to go to jail, they should come after you. But it's just amazing how the force of the government is like this just giant iron boot that just comes down on you in every way, shape, and form. Getting back to work was really hard for me in the emergency room, because a lot of hospitals didn't want to privilege me, because they look at you and they say, oh, well, you got indicted. And I said, yeah, but I got acquitted. Yeah, well, you got indicted, so we don't want to, mess with that. And then even if they will take you back, I had trouble getting malpractice insurance, because they say, well, you haven't practiced emergency medicine in 2 years. So I actually did get back to work. I work in the emergency room sometimes on the weekends, but I got a great job. I drive around and I provide medical care for inmates, actually, at county prisons and jails. And I love my job, and I think it's fantastic. And it allows me to really, I think now I have a better appreciation for what these people go through, and that they're human beings and that they deserve to get good medical care. And, it brings me great satisfaction to be able to make sure that they're getting the quality care that they deserve. So,
my wife thought firsthand, and she was obviously in the federal one, and they still need to work that out, because the care there is, horrible.
I've heard horror stories about it.
So
Yeah.
So you have court in August.
Yes,
Are
sir.
you trying to do whatever you need to do so it doesn't even make it to that point between now and
I'm
then?
trying. My lawyers, like you said, Mike, don't say a word, don't speak to anybody. And I didn't for 2 years, but yet the government's free to speak to whomever they wish. And they put out these horrible press releases and they call you all kinds of names. And at the bottom, it says, innocent until proven guilty, which is total BS, as you said.
I think the print's even smaller. They do the print
Yeah, exactly.
smaller.
Yeah.
It's in the visible ink.
Right. So, after all this started, I made a decision to go public, and I talked to my lawyers and they actually said, you already went through a trial and you testified. Like, what are you going to say that hasn't already been said? Like, go for it. I was very surprised because I thought they were going to be very anti doing this, but they were like, you know what, if it makes you feel better and you think that there's a chance, go for it. And I'm just trying to get someone in Trump world to just say, like, just to be objective, to take a step back and say, let me look at this case objectively and see what we have.
With common sense.
Because right, use some common sense. Because like the Biden people knew what they were doing. They appealed it right before they left office, because once you get the case started, it's hard to stop it, and it's like a snowball. It's just rolling downhill. And the DOJ's got thousands of cases, and they it's just one more case. But I got to find that right person to look at it.
So just to give you now that I'm in, and I just listen to this crazy stat, right? When we moved to Florida, I moved to Martin County. Now, Martin County's 30 miles north of West Palm and all that, and Palm Beach. So Dave Bongino lives here. Ann Vandersteel lives here. A bunch of other podcasters, and a lot of people come from West Palm and have the post office boxes here in Palm City. Now, Brian Mass is the congressman for here, and I've called him, I've emailed him. They even called me like last April. He's too busy to even look at this. So I was PO, but I was like, okay, typical politician nonsense. But then, like, my horns got twisted like 3 weeks ago, and I was like, you know what? Screw him. I emailed him again, and I sent a very nasty, long email, very stern, not nasty, but stern. They called me, and case in point is, supposedly they're pressuring the DOJ to review it, like I guess whoever their connection is, to review it, because I'm asking for a hard pause on my sentencing for that reason. So maybe there's something that you could try to do something like that, or do it with DC to an extent, or find somebody that's more conservative that would be willing to help rather than just another.
Well, that's what I'm trying to do. And actually, I think this kind of stuff is so important, the stuff we're doing right now, because you just never know who's listening. And I'll give you a great example. So I was on a podcast with a woman named Dr. Mary Talley Bowden. I don't know if you guys have heard of her, but she's a ENT doctor, ear, nose, and throat, out of Texas.
You did it recently, right?
In December, yeah. She's wonderful, and she was a big, very active during COVID, and she was a big ivermectin. She pushed ivermectin, and she's a very smart lady. Anyway, she had me on her podcast, and about a week later, my phone rings, and I answered because I didn't recognize the number. And on the other end of the line, he says, "Hey, Doc, this is United States Senator so-and-so. I saw your interview with Dr. Bowden, and I'd like to help you." And he spent about half an hour on the phone with me, and then he gave me his personal email address and said, "Make an appointment, come see me in DC. I'm only about a half an hour outside of DC." So I spent an hour with him and 3 of his legal staffers in his office. And we went through my case, and their jaws dropped, and I had to pick them up. And they're like, "Seriously?" And, so my point in saying this is, I think he will hopefully be helpful, but you just never know who's listening or who's going to catch, a little bit of this and say, "Wow, this seems very unfair," or "This seems very un-American," or "This doesn't make sense to me. Let me look into it a little bit further." And you realize that there's a lot of people like us out there, the 3 of us. And, maybe somebody will hear this and pick it up. And that's why it's so important to speak, because, when people get upset and angry, and then, you know what? It looks a lot better, Mike, if somebody sends their congressman a letter on your behalf than if you send the letter, right? So if someone's listening to the podcast and they say, "Wow, that seems really unfair, let me reach out to my representative," that looks a lot better than if I did it myself. So, again, you want people to understand that this is real. This lawfare, this weaponization, this is real stuff. And again, the first point I think we talked about was if they could do it to us and they could do it to the president of the country, of course they could do it to you. And
Yeah,
they
they can do it to
will. What's
anybody.
to stop them?
And even to go on what I've said this multiple times already, but like for people watching, like you don't know who's watching. That's exactly why Alice Marie Johnson is not still in prison. Because I mean,
That's right.
She tried to get pardoned twice or three times under Obama and just went nowhere. And did an interview similar to this, and Kim Kardashian literally saw it and said, "This woman does not deserve to be where she is anymore." And she used her voice. And a lot of us don't have voices like that. And some of us don't even know people that can give voices like that. So that's why Mike and I wanted to kind of do this, is to just try and give people a voice to get to someone with that microphone, you know, with that ability.
With the microphone, like for me, like I was saying yesterday, the ones that have become like big because they were big Trump advocates and debunkers of everything else. Now that they're big time, they forgot who we are, right? Now they're and listen, I'm not going to discount that every 5 minutes there's another major news breaking because everything for the past 4 years is being exposed, right? But at the same time, they should be humble enough to respect the people that followed them when they were up and coming, that when they became something else that they are now, high profile or White House press corps or whatever it is, take a step back and really see what helped you get there.
Yeah, and I feel like mainstream media is a joke. I mean, President Trump could literally cure cancer, end wars, and run out of a burning building with a baby, and they would still skew it that he's somehow evil.
He set the fire. What are you talking about?
Yeah, exactly.
You know, it is. It's crazy the level that the people just hate that man with a visceral hatred. I can't put my finger on it. I don't understand it. Like
we saw it
I don't hate anybody like that.
We saw it
last week. He stops the steal just like you did. He used you when you did something good.
But just the level of hatred that the average like leftist has to him, it's just like I didn't like President Obama. I thought he was a terrible president. But I didn't have this level of vitriol to him. I would never disrespect him like people disrespect Trump. I would never, be like to my friends who support him, like, you're the worst person ever because you support that guy. Like, we disagree, fine. Like, I don't think he's a particularly good president, but I still respect the man for becoming president of the United States, and I respect the office. And I just, the level of hatred and malevolence towards him is just like, I don't understand it. I just don't understand it.
Because the average American looks at, and especially the leftists, like, I'll admit Obama and Clinton were great speakers. Like, they could
absolutely
show up in a room and get everybody's, and people don't, I get Trump's, how he speaks. He tries to be funny sometimes, and they skew it as whatever. I get, and I understand exactly his.
But speaking doesn't make a great president. Actions do.
Correct. Yeah.
And they just don't like him. And I think it's because he is trying to get rid of all the fraud and clean up everything. And that's going to hurt them. And I mean, you're already seeing all that stuff, and they're in panic mode. And all they know how to do is criticize or make up shit. Like, and like,
that's true.
I think he set them up great at the State of the Union. I mean, I loved how I think they had that all planned with the cameras. Instead of kicking people out, they zoomed in on their faces and calling them out for stuff. Like, it's my father-in-law says the most dangerous person in the whole entire world is a white liberal woman.
Yeah.
The craziest too. They're proving it to me.
Yes. You know what? I'm sure you guys have thought of this, but one of the things that struck me recently, and maybe to frame it this way, is what I find remarkable is that, and this just shows their priorities, right? The priorities of the former administration. They had all these files on Epstein, right? We're just going to use him as an example. They had all this badness, this horrible things that this man and his cronies and other people involved in all this did to little children, right? Murder, infanticide, rape, pillage, like you name it, like just stuff that you're just like, oh my God, this is like a bad novel, but it's real. They didn't release any of that. They didn't prosecute a single person. They used the resources of their DOJ to come after us. Now let that sink in, right? Instead of going after murderers and rapists and horrible people, they use their resources their finite resources, by the way, to come after us.
Well,
what does that say about their priorities?
If there was all the stuff in there about Trump, they would have done it to make sure he was in jail right now.
Of course,
that's
of
course. I love how they keep saying they're hiding the Trump stuff now.
They would have arrested him. They would have arrested him right away. Why'd they sit on these files? I mean,
because powerful people are named in those files, and Trump's he's like, fine, I'll release them.
Yeah,
but
you see, like
some of the videos.
Go ahead. Sorry. No, go ahead.
I was watching some of the videos of the Hillary deposition, and she's getting they're lying on a recording, and they let them go home.
I know,
right? Like same thing. Like I said, how do people are allowed to commit perjury in court cases? There should be somebody out there to arrest them. If somebody has to reread the testimony of a quote-unquote expert or something like that of what they said yesterday, because today they said something different, there should be a marshal or an officer of the court ready to take them in over perjury immediately. And people perjure all day long. I'm sure you have probably the first case, Dr. Ron, your first court case, somebody definitely lied on the stand. You're like, he's lying. Right? I'm sure.
I can't really go into those details, but 100%. Yes, there were people who told, and then to the Fourth Circuit. Yes, there was like just blatantly made up stuff that just, I'm like, what the hell is this? Where did this come from? That's not in the transcripts. Just out of thin air, made stuff up, and there's no consequences. Like, it is just mind-boggling that is the system and that they can get away with it. And you're right, Mike, nobody faces consequences. No one goes to jail over it. No one gets arrested for perjury. They just, move on. I would have thought lying to a federal judge or to a court of any kind is a federal offense, but
only to you.
I guess it's not. Yeah, only to me. Exactly. Yeah. Yeah.
I forgot to ask, did they like raid you? Did you have that 6 a.m. wake-up call?
No. And Mike, to your question earlier, like, what evidence did they withhold? They didn't have any evidence. That's the thing. Like, there was no evidence, so they didn't withhold anything. Like, they had the evidence. I'm not exaggerating. Like, there was no evidence presented on their side. Like, the evidence was my tax return. Look how much money he made. I didn't even make that much money, but they went and they showed this was the business tax return. I mean, this is what they showed. They showed the business tax return pre-COVID. So the year before, I'll make up a number. I don't know. Maybe the business brought in $800,000. We didn't make that, but that's what the business brought in.
Yeah.
And then gross. Thank you. Oh, well, we saw 100,000 people. Of course, we brought in $20 million. We went from 1 site to 8. How is that a crime? But that's the evidence they presented. Like, that's evidence. That's evidence of a crime. The fact that a business was, grossing more money because they saw more people. Like isn't that common sense? It's just
businesses during COVID, especially the mortgage world. I mean, there's people that were making 1,000% more just because the boom of the housing market during COVID. I mean, I know a lot of people in that world that, I'm just throwing out numbers too, that were probably making maybe $500,000 a year that made $5 million.
Well, and even so, like, isn't that what a business is supposed to do? Like, the only person that thinks that
you are a liberal Democrat, they do not want you. They want you to take their handouts and be compliant and shut the fuck up.
Right.
They want you to make $5 million. They just want you to kick back $1 million to them.
Right.
And they'll always do it. That's the only way you'll always be allowed to make $5 million. The problem is we made it. They didn't want us to be successful doing it. Peter Tickton told me a crazy stat when he first took me on to do my pardon for President Trump. He goes, the $5 to $30 million net worth increase under President Trump's presidents, or rules that allowed you to make that much money for the individual or businesses, those are the people that they wanted to hurt because they knew you were big enough but small enough for them to squash you like a bug.
Mm-hmm. Yeah, and you couldn't hire all kinds of attorneys and whatever to defend yourself, right? Yeah. Yeah, I mean, again, I think that's part of the playbook is that that's why so many people take plea deals. At least that's what I'm told. I mean, I'm not an expert on this, but that's what I'm told is that, they know that they can come after you and they can threat. Look, you get indicted. You don't understand what the indictment means. You don't know anything for like 6 weeks or 8 weeks, sometimes 6 months. I mean, in my case, it was like 6 months before I even understood what they were coming after me for. And then they send you all this discovery and it's got all these seals of all these government agencies on it, FBI and all these scary looking 3-letter agencies. Scares the crap out of you. This is like your federal, like it's very, very scary. And they know that. And they know that they can beat you into submission and then continue to keep beating you. And you don't have unlimited resources. They do. So they can, wait you out and then make you plead to something that you didn't do because. And by the way, like most of the stuff doesn't come out because people do take a plea deal. So then even if they made stuff up and they were like completely doing things illegally, it never comes out because the file gets sealed after the plea deal.
Yep. I mean, that's what they did.
So nobody ever knows. No one's ever the wiser.
Right. All my competitors, because of what they did to me, they've all pled. They all changed their pleas from innocent to guilty. All my competitors, they only came after like seven to nine competitors, and it was the same thing. We were from a Staten Island or an effect product that was Staten Island's pretty red.
Yeah.
Or they were vocal about their support for President Trump. It's unbelievable because there's other funds like mine still operating. They're just never vocal about their beliefs, or that they're on the other side.
Yeah. By the way, Mike, I've never asked you, Rangers or Islanders?
Rangers.
Nice, good job, good choice.
That's a hockey, right? That's an East Coast thing.
Well, you have a bunch of teams out in California.
Yeah, we went to. I used to go to a Kings game a lot because when I was living in Hollywood, I went there one time. And this actually when it was early '90s or early 2000s, and we were actually editing my first movie on the Warner Brothers lot, and I get a phone call from one of the guys that was in my movie, and he's like, "Hey, do you want to go to Kings game tonight?" I'm like, "Sure." His name's Patrick Van Horn. He was in Swingers, and we show up. He's like, "Yeah, we're gonna meet my buddy Matt." I'm like, "Okay." So we get there. We meet Matthew Perry, and we're sitting right behind the glass of the Kings, and literally, I don't know any of the players, but like one of them turns around and asks Perry for an autograph.
That's cool.
And I'm like 21 at the time, and then I met a bunch of other. I know I don't know if you know the actor Michael Vartan. He was in like Alias and stuff. He was a huge hockey fan. He was in like also that Drew Barrymore where she goes back to high school or something. But he's a pretty big actor too. But like he was super into hockey, so I would talk to him here and there, and he'd teach me terminology and stuff. But yeah,
it's a great sport. Great sport.
I don't have the angles for it.
In Florida, believe it or not.
Yeah. Well, the Panthers are really good. I played in high school and college, and now I coach. My kids play. I coach at the Naval Academy, actually. I live in Annapolis. The U.S. Naval Academy is there, so I coach at the Naval Academy. And it's I love it. It's great. Best sport there is, as far as I'm concerned. I'm biased, but I think it's the best sport there is.
Yeah.
The amount of equipment the kids wear, or anybody wears, I mean.
Yeah, it's a lot. It's a lot,
and
but it's pretty light.
Smell on the equipment, no matter how many times you wash it. That's what my wife does.
It's brutal. It's brutal. Yeah, it's really hard to get rid of that. Yeah.
She's like, "What do I got to do?" Like she takes the bag out, hoses it down. You
doesn't matter.
Nothing. That's it.
The only thing that works is they sell these ozonators. So you seal them in a bag and it creates ozone and it kills all the bacteria in there. It takes like a half an hour. And then you can unzip it and take it out. But even then, it still stinks. It's just less of a stink. There's always just you can't get rid of it. It's not worth trying because you can't,
That's how my oldest son's room is. I'm like, where's the smell? Okay, use more deodorant. come on.
Yeah. Here's some Febreze, right?
Oh, yeah, I'll spray that on the beds and stuff. But
Yeah.
I'm like, when's the last time you put on deodorant? Because you are 14. You're around a bunch of girls. Come on. Like, he's just.
He's not alone. I think that's a universal truism for 14-year-old boys.
Yeah, we lived it. We went through it.
Yep. We all did.
Good times. Yeah. I mean, I've obviously been raising them for a year on my own, but.
Yeah, I'm sorry.
Yeah.
No, we did get some good news today. So I don't think I've told you, Ron, but like Erin, I picked her up on the 17th of February from her camp to take her to a halfway house. And it's still about 5 hours away from our house. And
That's great.
didn't know if she was going to get put on a monitor and be able to come home because she doesn't need the programming. Like, we have a house, we have our own business. There's no, like, why would you get a job at McDonald's for a month? Because she's supposed to be there for a month. So we've heard stories where they'll let you, just put a monitor and let her go home. But then she found out from the halfway house, they're like, well, you live too far away and you're supposed to check in like two to three times a week. So you probably just have to serve the rest of your sentence here.
Oh, my God.
We're like, are you fucking kidding me? And you already know how creative I get. And I don't know if you saw how I made that video and I posted, I aired it in a bunch of different cities, but I also posted it on X. It was with Todd Chrisley and Director Marshall talking about how, the BOP wants to now, we're trying to get people home as fast as possible. They're not a number, we're like, we want them to their family. So I kind of used his own words against him in this video and posted it. And then just at the end had Erin's like BOP number and, like kind of like just a brief thing about her, like her time credits and what the halfway house is telling her. And I tagged Todd and Director Marshall on it. And then I don't even think it was 20 minutes later, Todd Chrisley DMs me. It's like, what's going on? Like, give me some info. So we've been talking and he basically, I think he's really good or knows them really well, like Director Marshall and then Rick Strover, who's like assistant director. And to make a long story short, Erin last Friday got a call from Strover, Rick.
Wow. At the halfway house?
About what is called FLM, which is called Federal Location Monitoring, which basically would put her home on what like all of us are on like right now, like, just pretrial service. Like, it's like the same thing. Like, you're just home. I think you have to have a couple phone calls. I don't even know if you are on any kind of ankle bracelet. I think they do that case by case. And so she'd be able to do that. And then, so she talked to Rick Strover last Friday and he said, let me bump this up to DC and see if we can get this approved. It might take a couple weeks on our end. And so I text Todd about that and just kind of filled him in. And I think he like basically called Marshall just saying, hey, can you kind of look at this and make sure it's done correctly?
Gets through. Wow.
And then Erin just texted me this morning with a screenshot from Rick Strover basically saying, okay, we've done all the review process and yes, you're a perfect candidate for FLM. So now we just have to send it to basically probation because they would be the ones doing the monitoring. So that might take a couple weeks. So something that was supposed to take a couple weeks within the BOP took 4 days, but it's what I've been trying to say. And that's why I think we're all here. It's, you got to just get the word out and just keep pushing as much as possible on all ends. Because you don't know what might stick to the wall or what's going to fall off. And
that's right.
I've been lucky to kind of, hopefully we'll find like probation will agree to it, which I mean, they should, but like win this at least little battle within the war. Obviously we all want to win the war.
Right.
We know what that is. Like basically having Trump personally see all of our stories. So, I think that's why Mike and I wanted to just get this podcast going.
I think this is great. I think this is wonderful. And thank you guys for doing it. I think it's a brilliant idea. And I think it's a needed thing. And as I said, like the more people you talk, every time I talk on any podcast, anything, I always say like, I'm not alone. And that, the more I talk to people, the more I realize that there's a lot of people like me out there that with similar stories that just, that you just cannot believe on face value. Like there's got to be something wrong here. Like there's got to be, he's not telling me something. But for me, I think I'm a little unique just because I have a 93-page opinion from a federal judge. But beyond that, everybody's stories is the same. It's all like, they came after me for nonsense. They're ruining my life for nonsense. They're destroying it. I mean, like, I'm not unique. My story's not unique. It's just, it's just, again, like crazy. And this is real.
In your
This
own
is
little, in your bubble of your world, that
correct.
is unique,
Correct.
but
We're all the
then
norm, unfortunately.
right,
Yeah.
like you feel like alone. I felt alone till I met you guys.
Oh, the worst.
Even up until I did the first ever interview, I did it like 2 weeks after the trial, and I was a disaster. I was an emotional mess. I'm like, they found me guilty without, and again, and I'll tell you, the most things I'm worried about is I'm going to go to sentencing, and they're going to put me away waiting for the appeal, and then they're going to come after my stuff and put my wife and kids on the street, which is the thing I don't sleep about. You say you don't sleep. Sleep is like I need a sleepcation when this is over. God willing.
Absolutely. Knock on wood. God willing. Yes. 100%.
I mean, this is God's thing. He wanted to bring us all together to fight together.
So to your point, Mike, I'm as I said before, I'm a very happy person in general, and I always try to find a silver lining to something, and that's exactly what I say. What you just said, I said the only good thing that's going to come out of all this is that I have met people like you guys, like people like Cynthia Hughes, from Weaponization Watch, and Doug Mackey from Weaponization Watch, people that I never would have crossed paths with otherwise. Like what possible reason would there have been for the three of us to have met if not for this, right? And I can name 100 people like you guys that I've met because of this horror show that I never would have otherwise come across. And I think is a blessing. Like you meet some really, really good people that you otherwise never would have met. And I'm thankful for that. I really am. I'm thankful for that. And I'm thankful for a lot. I mean, yes, this is going on. This is terrible, but there is some good stuff that happened. And, to your point, like we all met and we came together and, God's plan, whatever you want to call it, like, sure. And I think it's a good thing.
Well, yeah, because I think we're all in the same boat. We probably have lost some friends, friends. And then
quote unquote.
There was someone that I was decent friends with him, and I've known him for a long time. He actually used to play for the Chargers football team. He was a special teams, like all pro. His name's Kasim Osgood. And ever since the day Aaron left, he texts me every morning, a devotional.
Wow.
I mean, and he's a Trump supporter. He's very he gets it, and he's just like blown away and tries to help as much as possible. And then you have the other friends that, like, they're just, especially at school pickup. Our kids go to private Catholic school, and like you can tell the almost the junior high mentality of the parents there. That
yeah.
And I just have to
you got the scarlet letter.
They're not happy with their lives, and they need some shit to talk about. Because, I mean, Aaron and I, before all this, we've always been joined by the hip. We always ran businesses together. We were always together, and people would make fun of us for that. Like, we were best friends before we started dating. So, I mean, that we just had that bond. Never spent a night apart ever prior to her leaving. So, people will find a way to talk shit, and sometimes they don't even want to know the truth because they're scared of the truth. Like you said, Ron, like they're scared it could happen to them. So I'd rather, and I've given this example before, like, especially when you hear like someone young dying, like a celebrity or whatever, you kind of want to hope it's because of like a drug overdose.
Right.
You don't want to hope it's because there was like an underlying heart issue that they never got checked, because then you're like, well, I'm a hypochondriac. Could that happen to me?
That could be me. Yeah.
Same thing in this DOJ prosecution world. Like, oh, like I went to Costco and I accidentally used my business card instead of my personal card. Are they going to come after me for like that, like stupid shit? Like,
There's a great book. I'm sure you guys have heard of it. 3 Felonies a Day.
yep. I almost mentioned it about an hour ago in
It is the scariest book I've ever read in my life, but it's the, it basically to the listeners, it's great. I highly recommend it. It's a good read, but it really just goes through. And if you're like living a normal life in the United States of America, you are most likely committing at least 3 felonies a day, totally unbeknownst to you. And to the point, like again, with my case, at least, like they don't even understand their own rules. The federal registry is like 600,000 pages, or there are 300,000 crimes or something like that. It's just ridiculous that, they don't even understand them. So how can any human being possibly understand all that stuff that, and you're expected to understand them because you could potentially be committing these crimes? It's just crazy. But again, this is the world in which we live. So they could come after you for any one of those 3 felonies, like at any time if they wanted to.
Although they can make one up.
Oh, right. I recently read about, I don't know if you guys heard about this case. Trump pardoned the guy, I think, but he was a marine biologist in Florida, and he was scuba diving, and he came across a bunch of sharks that were caught in a in like a net. And he's like, this isn't good. Sharks are endangered. So he went and he cut the net and he freed the sharks. He surfaced. He called the police. He had the police come out. He showed them where it was. He documented everything. The federal government indicted him because that was a NOAA, NOAA, National Oceanographic and Atmospheric Association experiment or something. So the feds can kill sharks, but apparently nobody else can. They indicted him and he was found guilty, and he faced like years in jail for freeing freaking sharks. And Trump found out about it, I think, and pardoned him. But like, that guy's life was totally ruined for doing the right thing, when he came across it. I'm like, but again, you can't make this stuff up. And he had no idea he was breaking the law. He called the police, for God's sakes.
That's when common sense is just thrown out the window.
Completely. Yeah. Anyway,
I
it's
feel
crazy.
like Trump is trying to bring common sense back, but obviously, I mean, just the stories you hear about his day. I mean, the guy is doing everything possible. So
Yeah.
Not just with the criminal justice, but just in the world, like he's trying to fix a lot of shit. And the guy never had to run for president. I mean, he's a billionaire, but and Roger Stone told me he tried to convince Trump to run in the 90s. And he's like,
watch it. It's on the Netflix special about him.
Yeah.
Roger Stone's asking him then, if he's sexist. He built Trump Tower. His Trump Tower, the engineer was a woman.
Right.
His top security guard, his top head of security was a black fly NYPD officer. I mean, the thing on Netflix is so on the money about him, and it's just pure people that were around him. The stuff that's documented and just about who he is.
Well, it's believe me not in your lying eyes, right? It's like all those pictures of him with Jesse Jackson's arms around him and Al Sharpton's arms around him, all these people, like, and then as soon as he wants to run for president, now he's the world's biggest racist. Like, it just, again, believe me, not your eyes.
Every rapper was rapping about him.
Yeah, exactly. I mean, it's crazy. Like, the whole thing is, again, you can't make this stuff up. It's just, but you tell a lie long enough and it becomes, people will buy into it. So.
Yep.
Yeah.
Anyway, well, listen, guys, I got to run. I'm sorry.
No, thanks for
this was awesome. Thank you so much. I appreciate this. This was great, and thanks for doing this, and thanks for hosting it, and thanks for taking the initiative. Like, this is so important. So, anything I can do to help, like, let me know. But this is just like, I don't even know what to say.
I think all we need to do is get the word out, because again, we want to try to get everybody in that group in here to just come and do this and just be able to, they could tell this story and how, because we all need to be told. And then hopefully the more we pump this out, somebody will bound to hear one, and then you got to sit there and you can't just listen to one. You're going to have to listen to all of them.
Right.
Yeah.
It's very intriguing when you start hearing stuff, because you're like, wait, I want to hear the rest of it. And then again, you're like, this can't be all that, because you always, again, to your point from before, like you think that they must have, that's the federal government. They must have so much on you. They must be, they must know what they're doing. They're the feds. They know everything.
Yeah. Yeah.
But
yeah, thanks for coming. And then
no, thank you guys.
Go back to saving lives. And
thanks.
we'll probably definitely be talking to you, just here and there after. So
yeah. And Chris, let me know about the thing we talked about earlier.
Okay.
Let me know but yeah, definitely. And let's keep communicating on that DM thing that we have. So,
absolutely.
Keep each other up to date and stuff. All right. All right.
Thank you,
Thanks a lot, guys.
And,
thank you.
We'll see you all later.
Thank you.
Bye.
Thank you, Dr. Ron.